We knew that there was a high level of child poverty really across the UK actually in certain communities, and we wanted to reduce the levels of poverty in these communities. We also knew that there was a high level of underclaiming of benefits as well. We wanted to explore that.
Right back in the early days when we were focused purely on midwifery services, we pulled together a partnership with senior health colleagues, and we also had a range of colleagues from Money Matters, both the manager and the practitioners from that service. So I think having that group of folk, as I said, at different levels, including the kind of senior manager level, has really helped to ensure that the work is embedded, and it's embedded within health, because you need that leadership to make sure that it continues.
My role within the workforce development of Health and Welfare Children is to go out to health visiting and midwifery teams and give them information on the Health and Welfare Children programme, and give them background about child poverty and the Child Poverty Act and why it is that this programme has come around. And I do this in conjunction with the Health and Welfare Children Income Advisor, who will come with me, and she describes some case studies of families that she's seen, how she's helped them and the income that she's managed to help them maximise, and if there's been debt, that she's helped minimise the debt as well.
Yeah, money worries are an important question in the initial assessment of a pregnant woman. If a pregnant woman comes along to the health centre at, let's say, 8 or 9 weeks of pregnancy, one of the first questions that she's asked is, do you have money worries?
The Healthier, Wealthier Children project is aimed at reducing child poverty. We look to see how we can maximise people's incomes. We look to see how we can deal with debts. At any appointment, at any point in the pregnancy or following the birth, the midwife or the health visitor should be asking if they have any worries, financial worries at all.
Every pregnant woman who we come across will routinely discuss the finances with them. We'll ask them at their booking visit if they need any further advice on their finances, benefits or housing issues, and regardless of whether they say yes or no, we will also offer to pass their details on to the money advice service.
Initially, when the health visitors and midwives were dealing with families, they didn't really know how to ask that question. Like, how do you ask somebody about financial? Like, you don't want to be too forceful on it, but a question card was basically developed. And it made it easier then for the health visitors and midwives to actually ask the questions, so it was a wee prompt for them.
We are asking families a lot of questions because we're building a picture of the family's abilities to parent. And one of the things that we do ask is their employment status. So with that comes an idea of finances, and that's the opportunity that I find the easiest opportunity to ask them if they have any money worries.
We need to focus our attentions on things that will make a difference to household income. And part of that is about making sure that families can access all the benefits and entitlements that they are due. And we know that not everybody does that. So, there's a real need for us to get to families at the earliest possible stage, ideally from pregnancy, and work with them to make sure that we're supporting their financial well-being.
This was a project that started from a tiny idea, this £3.10 food voucher a week. But it grew into this massive impact on household income. £4,000 into the pocket of a pregnant woman and that household has a huge impact. It allows them to not worry about making a decision about eating or heating.
I mean, if you just take like a standard phone call, we would have obviously if it was somebody having a first baby, we would have the £20.70, which is a week for their first child. We would have £53 a week is for their child tax credits, which is now the child element through universal credit. They could possibly have their Healthy Start vouchers, £3.10 a week. They could have their Issue Start maternity grant, at the moment £500, but going up to £600 soon.
So when we mentioned the Best Start grant, I would encourage women to consider whether they may be entitled to the pregnancy and baby payment, which they can apply for from after 24 weeks.
A midwife is very busy like all healthcare workers, they don't really have time to fill in lots of information. And we turned a tick in the women's electronic records about money worries into a referral to the welfare rights advisors.
I find it, really beneficial to have this service, because previously women would be asking us questions about what they're entitled to, and we don't always have the up-to-date information. Things change so much. So it's actually a relief to have this service, so that your women are getting the most up-to-date information and they're going to get help with their finances. And it's so important for them to do that, for their health and for the health of the baby as well.